Hey, good morning, everybody, or good afternoon, depending where you are. We are live in Charlotte, North Carolina at the American Nutrition Association's annual conference. We actually are really excited to have a conversation between the Ocular Wellness Nutrition Society, or OWNS, and the ANA. And we're going to be talking about implementation of nutrition into clinical practice. Although we are obviously very, very much focusing on what's happening in terms of eye care professionals and eye doctors, I think that this topic probably resonates for any clinician that is interested in nutrition, understands the power of food as medicine, and understands that we're in the midst of a lifestyle medicine movement, and nutrition is very much at the core of that. So I think this is going to be a really interesting conversation. I'm excited to be here today with both the past president and the current president of the Ocular Wellness Society, as well as a recent board member to the American Nutrition Association, as well as the director of certification program. So I'm going to start by asking you guys to introduce yourselves. Neda, I'm going to start with you.
Thank you, Lara. Thank you so much for setting up this event, actually, and hosting. I think being at the summit today for the American Nutrition Association gives us so much energy to really share the wealth of information that the ANA has for general practitioners, subspecialties such as optometry. So we're really excited. I am, as you said, the current president of the Ocular Wellness and Nutrition Society. My lifelong passion is to integrate health and nutrition into a practice to my patients, to a general population of practitioners to understand the core fundamentals of nutrition in clinical practice. So being the president of the Ocular Wellness and Nutrition Society has given me such a great voice to really help other doctors find that path. I'm blessed to have nutrition in my life as a core piece of why I'm healthy. So it's really a lifelong passion for me. I also have a practice that's based on nutrition integrating with eye care as well. And I'm happy to share all of the wealth of knowledge that, has accrued over the years and really collaborate with bigger organizations such as the ANA. So very happy to be here.
Thank you so much, Neda. Julie.
Hi, Dr. Julie Poteet. I've been with the Ocular Wellness and Nutrition Society for 9 years. I was honored to be vice president to my mentor, Dr. Stuart Richer, who many consider the father of ocular nutrition, for 6 years, and then president for 3. I've been involved in the nutrition world for more than 20 years, and I am passionate about the power of nutrition and lifestyle changes to mitigate the course of disease. We at OWNS consider ourselves a bridge between what the research scientists say and then practicing clinicians. Very honored to be an editor for a nutrition e-resource that OWNS and Jobs and WebMD have put together that's going to be published out next week. So it's over a year-long project. Very excited to be part of that. And I'm just excited to be here at the ANA. So, and I can't tell you how grateful that I am that we have a wonderful president here leading us into the future. So, yeah.
Following good path.
And congratulations on your new appointment at the board at the ANA as well. So that's exciting. Amy.
Good morning. Thank you all. I'm so excited to be here. My name is Amy Smith. I'm the Director of Certifications and Advocacy at the American Nutrition Association. I've been with the ANA for about 3 years. My main work is within the certification department. So my goal is helping nutrition professionals be certified in different areas. I myself am a CNS. I work clinically in the eating disorder realm, and I'm so excited to be here in Charlotte. We're talking about healthy aging and longevity, which is such an important topic, and just so excited to have everyone gathered and be able to talk about all of our passion for nutrition.
Absolutely. Thank you so much, Amy. And my name is Lara Zakaria. I am a pharmacist. I am a CNS. So I recently joined the board at OWNS this year. And everybody might be wondering, what the heck is a pharmacist doing on the ocular wellness board? Well, I was introduced to FOWNS through Neda, and I got to meet Julie from there. And I really am, I love the idea of integrating not only nutrition into eye health, but the prospect of using eye health to as a litmus test for other degenerative diseases and metabolic diseases. And that absolutely fascinates me. And I've been learning so much from you guys. And I've had the opportunity to really get plugged in and connected to so many amazing education opportunities. It's really opened up my perspective, my vision, if you will, to the possibilities of what we could do here together. So I find this partnership between the ANA and the CNS really exciting. And it might seem like, oh my gosh, we're thinking ahead. This is the future. But the interesting thing about optometry is that it has roots in nutrition, I dare I say, kind of ahead of the game, ahead of a lot of us medical professionals. You guys have been really steeped in the power of nutrition. Ned, I'm going to start with you. Can you tell us a little bit about the history, particularly in carotenoids? I think everybody thinks of carrots for eye health, but it goes a little bit deeper than that. Can you talk a little bit about that for us?
Yeah, so over 20 years ago, there was foundational studies called AREDS that basically correlated improvements in certain types of macular degeneration, where you can actually reduce the change by a simple add-on, where we, look upon vitamin C, vitamin E, and specific nutrients for the eyes that are called carotenoids, that translated beta carotene into lutein and zeaxanthin. But the conversation was there, and the fact that that became one of our core referrals for basing our recommendations to our patients who are basically having vision loss, that kind of just exploded the support from the eye care community. And we're not just talking optometry, we're also talking ophthalmology, to really help reduce the risk of vision loss for macular degeneration patients.
I do want to. So these AREDS trials were national. They're NIH, NEI, randomized clinical trials over a 20-year period. The AREDS data and what we learned from the AREDS trials changed the way we practice. It changed standard of care so that for certain patients with the leading cause of blindness in the developed world, macular degeneration, with intermediate to advanced macular degeneration, the standard of care now based on these NIH trials is to prescribe an AREDS supplement. So, this kind of transformed the way we practice and treat these patients with one of the leading causes of vision loss in developed countries.
Correct. And that goes hand in hand with just really going beyond that, right? So, supporting the patient with diet as well. And it just kind of expands our world past the view of, medicine, but also having nutrition into that conversation. It solidifies our view of how to really treat the patient into nutrition, bring them into nutrition.
Can you talk to me a little bit about kind of the role of optometry as primary care? We often think of primary care, your annual visit, you're going in, you're getting your basic labs done. But can you speak a little bit to your vision of how eye care fits into that picture?
I know Julie probably has a few stories. I have many stories. You ask any general eye care practitioner, there are way too many stories where sometimes we're the only doctor that the patient sees. And, the fact that we can scan the eye and find cardiovascular disease, we can scan the eye and find other correlations like cholesterol elevations, other types of just general health complications such as diabetes. We have that role of helping that patient find the real issues that they might have systemically, not in their actual eye. So just that foundation that we were able to see beyond the organ of the eye, have that tool, part of a routine eye exam, puts us in the foundational primary care role. So I don't know if
Yeah,
Julie, you have any other stories, but I have so many when patients are, they come to us first before even a primary care practitioner sometimes.
Well, I do want to say, listen, when I started practice, I did a residency in ocular disease at a VA hospital. We did not have at the time the imaging technology that we have now on this advanced level. We are a bit spoiled as a profession, the way we can image the retina. It's one of the few places on the body you can view the vascular system up close without a lot of tissue overlying it. So vascular disease shows up in the retina really early. And we are blessed to be able to intervene and have the opportunity. Every patient I have, I show them their retina, pictures of their retina. I talk about their vascular system. I talk about their macular health. I talk about prevention. My mentor, Stuart Richer, who is beloved, Stuart Richer has a mantra: repair the roof before it starts raining. Basically, if we can intervene in the lives of patients, start talking about ways to mitigate disease risk and show them their retina, their vasculature, the macula, it is powerful. And again, we as a profession are a bit spoiled that we have this technology that we can do that. So,
Yeah.
I think that is so interesting. I genuinely cannot emphasize enough how when we talk about prevention, we talk about assessment, this early intervention where early assessment where you can see it creeping up before anybody else can, I think is such a powerful piece. And very often, at least in the US, because of the way our healthcare system is set up, eyes and teeth sort of like are not in the body. And I think we tend to skip over that. And I think that's maybe something as nutritionists, we share that understanding of knowing it's sort of skipped. Amy, as you're listening to that, um, you know, I'm going to ask you a compound question. One, how are you hearing that and seeing the opportunity for nutrition and for sort of this alignment? And can you speak a little bit to some of what you hear as the pain points of trying to actually leverage nutrition and get it into these different cases and these different clinicians?
Yeah, I think that it's a good point to think about that sometimes also nutritionists are the care that someone receives instead of going to a PCP as well, right? So we're really facing the same issues with trying to really get people to think about nutrition as healthcare and think about the whole body system, everything working together all of the time instead of everything being very separate. And so I think there's such a great opportunity in nutrition and ocular wellness and in other areas to really combine that and bridge the gap that understanding that it is all a system that works together, and nutrition can really be the center of that. And as far as pain points, I think that awareness is the biggest pain point, right? Like that's one of the main things we have to work with our clients is that awareness that nutrition is so important.
Yeah, well said. I think that like for a lot of us, I know me going to pharmacy school first before I went down the route to go get a CNS, and I think it would be good for us to cover what it takes to get the CNS and what the options are for getting that nutrition training. But I know that in my primary education, I would say I probably got more than the average clinician because we are taught about supplements and nutrients. That, at least in my program, was something that was emphasized. We had a whole class on over-the-counter medications, and that included supplements. And so I got a little bit there, and then we get a little bit of nutrition training around diabetes management. That was it. I didn't really dive any deeper. And I often joke, it wasn't until I went back to get my master's in nutrition and I looked at the Krebs cycle for the 100th time, probably in my life and my career as in school, in education, and finally noticed that there were nutrients that actually powered the Krebs cycle. And it was an epiphany. Man, that day my mind was blown. I was like, oh, so when we talk about nutrients being important, they're literally turning the cycle that our metabolism, that is literally what we live, the reason we live, right? And so that was, I think, a big game changer for me and my path in education. I went the CNS route. I went and decided to get a master's in nutrition because I really had a passion for the biochemistry and being able to explain it. And then I ended up, going down that route. Amy, I'm going to go back to you. Can you talk to us about the different options in terms of clinicians that are passionate about nutrition, that want to be a part of this, that want to be able to have to feel confident in the conversation that they're having with their patients? What are the options for them to get literate when it comes to nutrition?
Sure. And if it's okay, I almost want to back up just a little bit and just really talk about the core purpose and principles of the ANA. So the ANA really focuses on being a champion of the science of personalized nutrition, right? So everything we're doing and everything we're thinking about is evidence-based, right? We're looking at the science of nutrition. And within that, we're really focusing on 4 pillars. So at the ANA, we're really focusing on educating the professionals. So there's several different options, which we're going to really go into depth about the integrating nutrition into practice piece, which is perfect for healthcare professionals who are wanting that extra training and already have nutrition in their scope of practice. We also have some training programs around therapeutic ketogenic diet, nutrigenomic nutrition, which is just just such an amazing realm in itself. And then we have the CNS pathway. The second pillar we really focus on at the ANA is certification. So the certification of nutrition professionals. And so our flagship certification is the CNS, and I'll go into some details about that. That's really the main certification we focus on. And then we have our newer certification, which is CFMP, which is for the healthcare professional who's just looking for that edge in the nutrition realm. The third thing we really focus on is advocacy. So we want to focus on extending practice rights for nutrition professionals and really ensure that we're protecting any practice rights that have already been established. So we really focus on advocating not only for the CNS, but for all healthcare professionals to practice at their level of training. And then fourth, we really focus on connection. So having events like this one and making relationships like with FOWNS and really working to connect healthcare professionals, and also focus on how do we connect nutrition professionals with potential employers or university programs, depending on what their interests are. So, talking about the CNS is our flagship certification. It is the most advanced certification for personalized nutrition in the United States. Certified Nutrition Specialists, or CNSs, practice new science-based personalized nutrition, really focusing on nutrition as the power to health. It's really focusing on spearheading the transformation from population-based nutrition to really focusing on moving from that cookie cutter nutrition to that very personalized plan that we can create based on you and your specific needs. It is a pathway to licensure in some states. So CNSs can become licensed, which allows them to take insurance and also have access to assessment tools like functional testing, which is really important for us to be able to offer that personalized piece. For all of our certifications, we focus on the 3 E's. So we have education, examination, and experience. So for the CNS, the education piece is that you have to have a master's degree or higher in nutrition or a health science. And then you also have to have 36 credits within the nutrition realm and biochemistry. So once you have completed the education requirements, we have an exam process. It is a 200-question exam that's offered twice a year, and that's going to fulfill that second E. And then for our experience, we require a 1,000-hour supervised practice experience to really ensure that you understand the personalized nutrition process. And after completing all of those, you're able to get that CNS certification.
Sorry. So if I am a clinician and I want to, I get this question a lot. I'm a clinician. I know it's really important for us to talk about nutrition with our patients. And I don't feel like I have the tools. I want to get there as fast as possible. I'm busy. Going down the full credentialing path isn't an option. Talk to me about the PMP program. Talk to me about how I can hit the ground running as fast as possible and what that could look like. And then I'm gonna start with you, Amy, and then I'm gonna pivot to Neda and Julie. And I want you to talk a little bit about the differences there that you see in terms of what tools that you have and how you're using it in your practice so that people can color that in a little bit.
Sure. So the CPNP is the Certified Personalized Nutrition Practitioner. To be eligible for that, you need to be a licensed healthcare professional. So that can be a pharmacist, it can be an optometrist, anyone who has nutrition in their scope of practice. The training program itself is integrating nutrition into practice. It's a clinically focused educational practice that arms practitioners with the skills and knowledge to apply personalized nutrition into their practice. So it's going to talk about the latest information in assessment and modalities and body systems. It also has a lot of practitioner resources that help you learn how to tailor a personalized nutrition care plan for your patient. So the modules cover 12 different systems. So we cover behavioral health, we cover assessment, we cover GI, we cover cognitive, which is so important to ocular wellness, and we cover metabolic health, again, so important. So you're going to go through all of the different modules. There is an exam process. So as soon as you're finished with the training, it's about 44 hours. So it is a 44 CE credit training. So it takes about 44 hours to complete. It's at your own pace. So you can do it on your schedule at your time. Once you complete all of the training, you're eligible to take the CPNP exam, which is a 100-question exam. You take it online. It's available to you as soon as you're ready. And upon passing that exam, you earn the CPNP certification. And like I said, it's really designed for those healthcare practitioners who already are licensed. It doesn't expand your scope because you already have nutrition in your scope of practice, but it's going to give you the tools to know what to do with that scope of practice.
So that is that what, right? So that answers the question, okay, what are my options? That is a great option. I feel like that is dynamic. It is, you can squeeze it in where you can stop and go at your own pace. Julia, Neda, in terms of actually practical implementation, can you speak a little bit to what some of those tools look like, and can you bridge for us now, like the practical application? Is this going to actually help me as a clinician? How does it help me? And do you have any tips for somebody who's interested in, it feels overwhelming, there's a lot of stuff that we can talk about when it comes to nutrition. Do you have any tips on how to start that conversation, and any advice for folks that are just treading water here?
Yeah, and that's the beauty of this newer program. It's the user friendliness of it for an average practitioner who believes in expanding the knowledge of their patient. So the practice that I think is the ideal practice, where you're teaching your patient not just about the condition that is causing issues in your eye, but also how to help mitigate. If you don't have that foundational education through something that has a certification or some sort of actual good resource core, then you might be missing the message to that patient. And how do you coordinate that conversation? So having that primary type of education is key, because we do lack that in pretty much all of medicine. So patients now have sometimes more education in the nutrition conversation than their practitioner. So to keep up with the times, we are at that point that we need to start understanding how to converse with our patients in an effective manner. And the only way to do that first is to understand the science, to understand the fundamentals. I do think having behavior change within the 12 module program is really important, because we have to also understand how to instill changes in our patients, not just by telling them what to do, but how to navigate that conversation more effectively. And the only way to do that is to be trained. And having something like the certification process, which is frankly, much more attainable to somebody who's working full time versus a CNS. Julie and I are both CNS graduates, and we we value the level of the CNS, rigorous level of nutrition education, but we also know that not everyone can do that. So having that conversation is probably the most important with the patient in nutrition, and having that education background is necessary as we lack it in our core training.
Yeah.
I mean, I'm sure you think the same way, Julie.
Well,
So.
nutrition is taught in less than 20% of medical and optometry schools. We as any practitioner that cares for patients today needs to be educated in what the science says, evidence-based. And that's what FOWNS is all about. Everything we advocate is evidence-based. There is so much erroneous information on nutrition out there. We live in the age of scientific wellness. Patients buy devices that measure everything: sleep, heart rate variability. You can get tests and measure everything, but how do I take this information that I'm getting, interpret it, and implement it? The practitioner of the future has to be knowledgeable and has to be able to offer their patients what the evidence says. I do believe that one of the things that has springing out of COVID is something I call post-traumatic growth. It was a term coined in the 90s by two psychologists that looked at a collective trauma from a society and what often happens afterwards. The plagues that swept through Europe sparked the Renaissance. I truly believe that COVID is sparking a renaissance of health, where patients and practitioners alike want to know how I can maintain wellness. So we are in this new age of a wellness movement with food at its core. May 2020, the NIH announced a strategic plan to accelerate nutrition research centered on personalized nutrition, how things like our microbiome affect everything from drug metabolism to our health. And so the doctor of the future, the practitioner of the future is going to be mindful of nutrition. And we as a profession, it's so important, in my opinion, for us to be armed with what the evidence says. Again, I think patients depend on us for that. So again, I'm so grateful to the ANA for leading this movement and giving us an opportunity and a way to become educated in nutrition science. So.
Thank you. And I'm going to pop the information about the FOWNS. Can you tell us a little bit about who can join FOWNS? Do you have to be, I know the answer to this now, but do you have to be an eye doctor to be part of FOWNS?
Technically, you do not. We have PhDs, researchers, we have students with various backgrounds. But no, it's because you have to think about the eye, brain health, eye health, they are all correlated. So being a part of FOWNS is not restrictive to just eye care professionals. Obviously, that's the highest percentage, but it's not restrictive because going back to the fundamentals that Amy was speaking about, we're a whole body, right? And if somebody from a different disciplinary wants to learn about the eye, that's why we're here. We want to spread that good information, that sound information, and it crosses multiple professionals.
I could tell you, since I've joined, I have a network of pharmacists, and a lot of pharmacists have expressed interest, and whether it be from personal experience, their own concerns about their own ocular health, or whether it be because they are seeing these relationships and finding them, fascinating. I want to encourage more pharmacists to join, because I have found it really interesting to be able to have conversations with you all, not only on the nutrition front, because obviously that's part of the focus, but we're also balancing and understanding medications and potential interactions and how that impacts eye health, and vice versa, how we're using medication for eye health, right? So I think it's really, there's a lot there to unpack. And I think, yes, eye wellness, vision, having, preventing things like macular degeneration, et cetera. All of those are really important. But I really want to encourage my non-eye doctors that are listening right now to really rethink of the eye as sort of a gateway for other issues. And so if you're in if you're in the medical field and you are working with patients, I think understanding those relationships can really put you ahead. Along the same lines, Neda or Julie, Could you give me an example? Can you give us all an example of something that, if you are working with a patient, an example of an intervention? Like, why can't I just give everybody ARIDS and just call it a day? Why does it have to be? Why do I have to get this extra training? Isn't it enough? Doesn't ARIDS cover the whole base? Or can you give us an example of where really having a good foundational nutrition knowledge can be advantageous for the patient?
I mean, unfortunately, I can navigate a great nutrition conversation with my patients, but one of the foundational parts of just eating, whether it's taking in a vitamin or food, is the digestive system. The digestive system changes as we age as a whole, and we miss the mark in terms of how we interpret how people absorb certain foods or supplements. So having that conversation with my patients about their gut system, just asking about it, yes, it doesn't technically relate to the eye, maybe in their interpretation, but for me, it's really important to know. So because I have the tools to navigate that conversation and perhaps give recommendations past, as we said, a supplement recommendation, they really are able to take that in and put these points together where they actually want to be a little bit more proactive in perhaps optimizing their digestive system with perhaps other supplements, food restrictions, food add-ons, where we might see improvement in their overall health. So that's just one big example, and that's a continuous conversation with elderly patients, but now even younger patients where we see gastrointestinal issues really common. So that's just one big prime example. I'm sure you have others, Julie.
Well,
So gut health, so addressing gut health and digestion beyond just let's slap a supplement on it, really getting to the root of it, because it's asking the question, why are there nutritional abnormalities? Are there digestive problems that are creating that abnormality? Are there other inflammatory problems that are stemming from the gut health, from the microbiome imbalances that are drivers of some of that degeneration? And so understanding those connections and being able to then address it at its root rather than, just doing a Band-Aid solution. Would you say that's a fair?
It is. And I do want to say there was an article just published that looked at rounds of antibiotics in elderly and higher risk of macular degeneration. So the more rounds of antibiotics a patient gets, their risk of macular degeneration skyrockets. We as a profession prescribe oral antibiotics. Our practitioners must understand how to prescribe in a manner that respects the gut microbiome, because the gut microbiome has now been linked to every eye disease. So every eye disease we look at has an inflammatory component. So we cannot look at inflammation without thinking about the gut microbiome. I never prescribe oral antibiotics without concomitantly prescribing a lactobacillus GG, which is an over-the-counter probiotic. And again, this is all evidence-based. But we just must be mindful of we got to mind the gut. So yes, we have to look at whole body wellness, because everything we do affects the eye. Any type of inflammation, any inflammatory condition can affect the eye. Eye disease, all eye disease has an inflammatory component. And so how do we know what drives inflammation, gut health, and the foods we eat? So yeah.
I'm going to take that and I'm going to go to Amy. So I'm sure, Amy, that in your work, you've collaborated with clinicians. I'm curious from your perspective as the CNS, working with those clients, working with those patients, where do you see the most powerful synergy in that relationship, where you as the nutrition expert are sort of really filling the gap? Is it through education? Is it through the direct collaboration? Can you kind of color that in for some of us that aren't familiar with that?
Yeah, for the ANA specifically, it's that education piece, right? So Julie brought up the great point of, or maybe it was Lara, who said, the root cause, right? So we don't really think about that. If you're, going to your PCP and given some medication to treat the symptoms, we're not thinking about what's causing it to start with. And so that's really one of the big gaps, right? One of the things we're trying to educate on. And that's really the personalized nutrition piece. It's not cookie cutter. It's very much developed for dealing with that root cause and figuring out what's happening. And,
Mhm.
you know, if inflammation is the source, where's the inflammation coming from? And there's so many levels to it.
Mhm.
And so really one of our focuses, I think, at the ANA and as CNSs is, you know, really looking at those really deep levels and where how deep does it go. And so with the CPNP, those tools are going to be taught to you to really see where nutrition is that kind of piece that fills those gaps and helps us to really figure out through assessment how deep we need to go.
Yeah. I'm a big fan of collaboration personally. I mean, if you know me, you know that I'm always trying to plug different professionals together with different interests and different specialties together. So I find this just it just makes sense to me. It makes sense to plug in the nutrition professionals that can really sit with coach, get to the root cause of something with the medical professionals that can focus on the bigger picture, the assessment and the strategy. And I just think that that is just such a beautiful way to collaborate and connect. Amy, I'm going to come back to you and just speak a little bit to that potential for collaboration. What is that? What is in your mind does that look like?
Yeah.
And what are the different ways or the different models beyond even eye care, but like what are the different models where we could see this come together?
Yeah. So collaborations like the one that we have with FOWNS is our path to scaling and delivering personalized nutrition, right? We want to get it into all of the systems, ocular wellness. And, recently we were talking to nurse practitioners and really thinking about how can we get everyone on the same page so that when someone comes to the ocular doctor, they're getting the information that they need to take back to their PCP and really working on collaboration on that level.
Mm.
Whereas healthcare practitioners, we all have the same thoughts and the same education and really focusing on opportunities for healthcare as a whole to recognize how important nutrition is and to have nutrition literacy at all levels. So we kind of think about it as a triad, and that top of that triad is the practitioner who's trained in nutrition, no matter what their specialty is, and kind of focuses down to the marketplace so that when they leave the eye doctor and they're told to take a probiotic to go along with their antibiotic, they know what to take. They know what they are looking for when they go there. And then there's the opportunity at the marketplace for us to have collaboration so that they know what to lead them to on the shelf. And then really thinking about the community level. And so there's collaboration opportunities at all levels to kind of bring personalized nutrition into the center of that and connect all of those opportunities.
Yes, thank you. I couldn't agree more. And I love what you said specifically that this is how we scale. The question is in the model that we have now, most clinicians don't have a lot of time to spend. And very often it's not just, hey, just go eat more kale or something like that, right? We have to get a little bit more granular and nutrition takes time. And I think this is where partnership, collaboration, we're seeing some really innovative models. And we're seeing this spike in technology and research. We're seeing like the conversations about gut health, like for example, that we were talking about before. We're talking about the impact of different specific nutrients. We're talking more about magnesium, vitamin D, and the impact of carotenoids and antioxidants. And so I think there's an amazing. We're at this point in time, at this really interesting place where we're all starting to see the evolution. I think the hard part, and I'm going to bring it back to being the practical implementation. Neda and Julie, can you talk to us a little bit about what you in your practices currently, what are some of the tools that you're using and how are you leveraging that to have that conversation, to bridge that conversation about nutrition with your patients?
So one of the biggest items that, I started practicing with my private practice is the fact that we exist where our nutrition arm is not, you don't have to dig to find it. It's a highlight. It's there. We are providing that care, right? So that's the first point because it is not a side. It's not a side help. It should be one of the main core fundamentals of helping the patient navigate an eye disease or any other type of chronic disease. So that's the first thing. Secondly, it's really getting the history down. So, I've taken multiple different types of certifications, and obviously the CNS was one of the most expansive. It's actually knowing the proper history. So when you see the patient's history and you see exactly what they're coming from, what they've tried, asking the right questions, actually digging into supplements, what are they taking? And most of them don't even put it on their intake form in a general medical setting. But if you ask the right questions, you'll get the right answers. And typically the patient is really, really happy that you're asking. And they'll actually remark, wow, I'm so happy you asked. No one asked me this. And if we just start from there, that is actually huge, because then we can navigate the conversations of change, because we can circle back to what the patient was doing, is doing. So that step is kind of easy, because you can implement it anywhere, right? That's not a machine. It is not, there's nothing that I invested in. It's just the conversation and having the right early on history tools. So I would say that's one thing that anyone can start very soon with in their practice.
And I'll interject to say that there is a study that I don't remember where, I don't have the details of it, but this number stuck out so much that I do remember that 40% of individuals reported that they don't talk about their supplements or their nutrients. They don't bring it up. So even when they do an intake, they'll skip it because they don't think that it's pertinent. They don't think it's relevant to that medical encounter. And I've kind of surveyed on my own. This is very not scientific now. And I'll tell you, the vast majority of people tell me they don't talk about it because they feel like they'll be dismissed. They'll feel like either they'll be told, oh, that's just expensive pee, it's not doing anything, or they'll be told, oh, diet doesn't matter. They've been told that in consultations. So they don't feel like they can have a clinician they can trust. So I think a big piece of what you're advocating for, Neda, is that we actually want to show that we are advocates for nutrition and that we are the ones that are going to be trusted. Now, I know most clinicians, our fear is that we're going to get that question that we're not going to have an answer to. And Julie, I'd love for you to kind of expand on that.
I do want to brag on our president, Dr. Gioia. She's a trailblazer, and her practice model is something that any practitioner can look to. She is, again, an example of a beautiful example of how to incorporate wellness into clinical care. And I do want to reiterate, for every practitioner who takes care of patients. Here's an example. And this happened a few years ago. I had a 17-year-old type 1 diabetic. Mom brings her in for a diabetic eye exam. And mom's like, she's on an insulin pump. She's just tired all the time. We just can't get her numbers regulated. We're frustrated. And I just mentioned in passing, has her endocrinologist done a vitamin D level in a while? And the mom's like, I don't know. So I send a note to her endocrinologist, and then I forgot about it. And about 3 months later, I'm in talking to my receptionist. The mom comes in the door, grabs me, and gives me a huge hug and squeezes me. And I just thought, okay, what is going on? And then she explained. She said, because of you, we learned her vitamin D levels were so low. And now after her levels are back up, she's like a different child. Little things like that. And there's things that we as practitioners should be mindful of. I mean, there's data showing that vitamin D levels are inversely associated with risk of diabetic retinopathy, but we need to understand the nutritional biochemistry behind it. Post-COVID, so many patients are hyper supplementing with vitamin D, and too much is not a good thing, right? So we just, as practitioners, need to be mindful of this. And the ANA is providing us an opportunity to gain that education. So,
yeah. So that is a really powerful story, and it's such a simple thing to think about that could be very easily kind of brushed under the rug, but just a simple screening kind of led to this really profound difference. And I would say the same thing. I would say I've seen this with something as simple as iron, not doing sufficient iron assessment and missing a low iron. because we just, ran a CBC and we didn't do a more comprehensive iron profile. So, and these are very basic nutrients, right? And dosing them appropriately in the right person takes a little bit of training. I'm curious, I think again, like most clinicians, because this is not part of our original training, we talked a little bit about sort of the power of implementing this training. And I'm curious if there's any, Amy, I'll go to you. Can you speak a little bit to any examples or any stories that you have about being able to use these like simple kind of interventions or these simple educational tools in a way that really has a profound impact? Because I think so often we think we have to know everything, and until we know everything, we shouldn't talk about anything. So can you talk a little bit about that?
Yeah, when you mentioned the fear of the question, it brought me back to being a new CNS. Oh no, what if I don't know the answer? Within the training itself, there is amazing tools. So there's clinical reference sheets for every single module, every single system. And they're literal handouts that you could print out and almost make yourself a handbook. So that in session, if something came up, you could easily flip to a page and be like, oh, yes, this is the answer to that. We're also providing tools on how to do that personalized nutrition assessment. So if that's something that a practitioner is not familiar with, so we're learning to ask the right questions, there's going to be training on that, as well as handouts that you can really use to start making sure that within your intake process or within your paperwork, you're asking those questions that are going to help get to the root cause, to know things like, oh, I should ask about their vitamin D level. So on top of the videos and the great research that's in the course itself, there's going to be so many wonderful tools that you can use as a practitioner. Make yourself a little bit of a handbook and have those on hand, or use them to give to your clients. So it's really going to be, a great way for you to have multiple avenues to carry that into your practice, and have the tools to feel confident when somebody does ask the question that you're not absolutely sure about.
Yeah. I find the most powerful thing, to be honest, and this has been true when I was a fresh green pharmacist, and even till this day, when I think, Dr. Neda, you said it earlier, like sometimes our patients are coming in more educated about topics, and they're really on, doing their homework when they're coming in to ask us questions. And I love that. When a patient comes in and asks me a question, especially if it's something that I don't know the answer to, I am so grateful that they trust me enough to ask me that question. And I think that shift in that perspective, that unlike 40% of the people that don't even want to talk about their supplements, I've got somebody who wants to ask me the questions and want to know my opinion. I take that very, very seriously. I take that trust very, very seriously. So to me, it's about being able to have the conversation, to gather as much information as I can so that I can answer the question. And very often I tell them, I actually don't know. Let me look into it, and I'll email you back. I'll send you my answer. Right. And they are always so grateful for that. The fact that you're even taking the time out. So I would say, just because if you've got any clinicians that are new to this space, or trying to bring in more nutrition to this space, or maybe you're a new CNS or a new RD and you're trying to bring this in to be open to these conversations, but you're afraid to be asked a question you don't know, you'd be surprised. Follow through and answer the question later. They will be so grateful that you took the extra time to do so, because it's just as simple as they want their question answered. They don't necessarily need it answered immediately. And I think that takes the edge off, that you can have that conversation, you can tread into the water a little bit, and start to understand what their concerns are, where they're getting stopped up, what are their challenges. And I think then you'll know where you can really dive into educate yourself in that specific area to really serve the population and the patients that you're working with. So as we're wrapping up, I'd love to just give a little bit more opportunity to talk about membership in both of the organizations, talk about the educational opportunities, anything upcoming that's coming up. I'm going to start with the ANA, since we're here. Amy, if you can tell us a little bit about, you gave us a great overview of what the ANA is about, but if you could tell us a little bit about any thoughts about the direction and what can we expect from the ANA? What does membership in the ANA look like, and why should we join?
Yeah. So we're getting ready to launch a brand new membership November 1st. And the membership is going to be slightly different. If you are a member of the ANA, it's been very focused on providing access to the summit and access to the journal. But there wasn't a lot of activity. So we're revamping our membership and really focusing on content and continuing education.
Mm-hmm.
So starting November 1st, we'll be launching a brand new content membership. You still get all the same benefits that you do now. So you'll get discounts on our trainings, discounts on Summit. You'll get access to the journal. But in addition to that, you're going to have an opportunity to get your CEs and to dive deeper into any areas of nutrition that you're interested in. So on launch, we're going to have about 150 CEs available, and that's going to be across the realm of different areas of nutrition, different body systems. So that's going to be just really great for people who are looking for that extra knowledge, that little area to dive deep, something you can listen to while you're in the car. So that's coming out soon. We're really excited about that.
That is
so
really cool. Congratulations
yeah,
on that, Amy.
and it's going to be great for practitioners across the realm that are just really interested in nutrition and diving deeper into those different content areas, that especially things like nutrigenomics and stuff that we know are very popular, but not everyone knows where to get the education on it.
Absolutely. I get that question actually specifically. I've got that question multiple times this year. So I now know where to send them to. And if my students are, if any of my students are watching or listening right now, this is what I talk about all the time is just go to the ANA and join. The membership it opens up the opportunity for so much community and so much support. One of my favorite phrases to say is, if you want to go fast, go alone. If you want to go far, go together. And I'm, again, a big proponent of finding the community, finding your people. And this is true for CNSs, RDs, and other healthcare professionals, right? All of us can use a community. If you're interested in the power of nutrition, if you're interested in being plugged into a community of other like-minded clinicians that are understand and appreciate the power of nutrition, you want to connect with other clinicians that are doing that kind of work, I think joining the ANA is a no-brainer. And now you're getting even more opportunities and even more education. So I really appreciate that. Neda, Julie, can you talk to us a little bit about FOWNS, and the same question to you?
So we just revamped our membership. So, and that was one of the biggest parts of our membership is this collaboration. So the Ocular Wellness and Nutrition Society, we've been advocating for integrating nutrition and lifestyle medicine into eye care for over 13 years. We're one of the few foundational organizations that talk to eye care practitioners regarding this important link. So with that being said, being a Ocular Wellness and Nutrition Society member, you do get perks. So we offer continuing education that are specific for renewing state licensure. Depends on the state, of course. We have a great continuing education course coming out actually next week. So we give our members that access. We also have web recordings of those webinars. Sometimes it's very heavy in information and it's nice to just listen in. So you get access to our old webinars, which is wonderful. We also have embedded discounts, and one of our biggest discount programs is with the American Nutrition Association. And that is where we can have our members access the education path that we had discussed tonight with a 35% discount. That is tremendous. And that is really what we are trying to advocate today, because at the end of the day, there's no more excuses, right? We've brought it to a point that it's accessible to the practitioner. The financial investment is low. And now you can actually start helping get that motion of change within our healthcare system. So that is a huge part of our membership perk right now. We are going to be launching our Doctor Lookup, which Julie is also putting into the e-resource coming out next month. The Doctor Lookup, so we've been talking about doctors and practitioners. It's actually patient access too. So think about it. You're a patient out there and you want to go to an eye care facility that maybe is a little bit more open to nutrition, right? So it's going to open up our members to a patient population as well, where they can find the doctor within their state, et cetera, within their area that has more language in nutrition education. That's a really exciting thing that's going to be launching in a few weeks. And I mean, we have a lot of perks. So we have journal access. We have other perks within our membership. I don't even know if I missed any. I feel like we have quite a few, but those are some big highlights.
Yeah.
I think that's amazing, and congratulations as well on the update and the new options. Julie, anything that you want to add? Any final thoughts?
I'm grateful to the ANA for giving our practitioners a way to be more, proficient in nutrition. Our patients are demanding it. Our healthcare dynamic is changing. The food is medicine movement. I was so honored last night to sit next to one of my healthcare heroes, Dr. Jeff Bloomberg with Tufts, who just initiated a food is medicine center. But we can no longer ignore the power of food to mitigate the course of disease. And again, we as practitioners owe it to our patients. And I'm grateful to you guys and the ANA for allowing us to have a path to do that. So.
Yes, we are also so grateful and just so excited for the partnership and just, showing how important it is for the connection and the collaboration and the partnership. So we are also so excited.
And I want to say the students are also watching. So as much as we're, giving access to licensed practitioners, we have students watching what's happening in wellness and in the nutrition arena. And we have a lot of active students that can't wait to further their education in nutrition after they graduate, because as we know, it is lacking in the core programs in all of medicine. So that is another part that really resonates with me, is to kind of keep it going with the next generation of graduates.
I agree. And so any of my students that are watching, please also consider joining both ANA and FOWNS. Such amazing work that you guys are all up to. I can't emphasize enough how much I've been learning. Obviously, I've been a member at ANA. I've been a CNS for several years now, and it's been an absolutely tremendous path. I have met some of my closest friends because of the shared mission and vision and the values that we have and our passion for what we do here in this world. And I am so excited to continue to see what's happening, particularly as FOWNS is expanding and building these collaborations and the opportunities for education. So I thank you as well for giving me the chance to be able to see how much more there is to eye health. It's not just about, corrective eye vision, right? We're talking here about just connecting it to our neurological system, the metabolic implications, the disease prevention implications, and all of that sits on a foundation of nutrition and lifestyle medicine. And I'm just so excited about the future for all this. For those of you who are also on that train, I really encourage you to come meet and join us. I think this is going to be an exciting phase for the future.
And I want to say thank you, Lara, for coordinating today's.
Yes.
Oh, it's my pleasure. Thank you for having me. I appreciate you all so much. And thank you for your time. Thanks for everybody who's listening. And I'll see you downstairs.
Yes.
Good. Thank you
All
so
right.
much.
Thanks everyone for watching. All right. Bye-bye.
Bye all.
Bye-bye.